Worst mistakes making nerve pain worse, and what to do instead. You think you're doing everything right, but what if your nightly routine, your morning pills, even your favorite shoes are silently making your nerve pain worse? Here are the 5 worst mistakes I see, and number 4 is something even most neurologists never mention. Whether you've just started managing your diabetes, or you've been living with it for 20 years, this video is for you. Because nerve pain doesn't care how long you've had the disease, it only cares about what you're doing or not doing right now. We're going to break down 5 critical mistakes that quietly worsen diabetic nerve pain, the kind that even experienced patients make. And more importantly, I'll show you what to do instead, backed by science, explained clearly, and relevant to your real life. Number 1, the painkiller trap. Let me tell you about Mark. He's 62, a retired electrician, has type 2 diabetes, and like many, he wakes up every morning with burning foot pain, that tight, tingling feeling that makes even slippers feel like sandpaper. So what does he do? He does what a lot of people do. He reaches for ibuprofen. Every morning, every night. It helps a little, until it doesn't. Over time, Mark notices something strange. The pain doesn't stay put, it spreads, gets sharper. His feet feel wrong. Not just painful, but somehow disconnected. Now here's the part most people, and even some doctors, don't realize. Painkillers like NSAIDs or even gabapentinoids, those nerve drugs you might have been prescribed, aren't harmless long-term. Your nervous system isn't just wires. It's a living, reactive network. And in that network, you have glial cells. Think of them like support staff for your nerves. When your nerves are injured, say from diabetes, these glial cells jump into action. They help clean up, protect, rebuild. But if they're constantly bombarded by chronic pain, by meds, by low-grade inflammation, they flip. They go from helpers to agitators. They start releasing chemicals that amplify pain signals instead of calming them. It's like turning up the volume on a speaker that's already too loud. So Mark, by taking ibuprofen every day, he wasn't numbing the pain. He was unknowingly feeding a loop that made his nerves even more sensitive over time. Have you ever felt like the very thing meant to help might have made things worse? Share your story below. You're not alone. Now, this doesn't mean pain meds are evil. They have their place, especially for acute injuries. But when it comes to chronic diabetic nerve pain, relying on them without understanding the biology underneath can backfire. So what can you actually do? The first step is to pause and ask, how often am I really reaching for these meds? If you've been using ibuprofen or nerve drugs daily for weeks, bring that up with your doctor. It's not about guilt, it's about strategy. Ask whether there are safer, longer-term options or if tapering makes sense for your case. And start experimenting with gentler, non-drug ways to soothe your nerves. A warm foot soak, a 10-minute walk in soft evening light, or even just resting your feet elevated for 20 minutes while listening to calming music. Sometimes, the most healing things cost nothing, except attention. And here's the kicker. You might not touch pain meds, but what if something as harmless as your bedtime routine is quietly damaging your nerves even more? Let's talk about that next. Number 2, sleep deprivation and nerve sensitization. Meet Linda. She's 58, retired librarian. Every night, like clockwork, she wakes up around 3 a.m. Her feet feel like they're buzzing. She can't tell if it's pain or just nerves misfiring. She used to think, maybe it's menopause or just getting older. But here's what no one told her. Sleep isn't just for rest. It's the primary time your nervous system resets its pain threshold, like recalibrating a scale. But when sleep is short, shallow, or broken, your body's natural pain dampeners, what doctors call descending inhibition, don't kick in. Pain isn't just physical, it's exhausting. And when your brain never gets the chance to reset, your nerves become like tired soldiers, firing at everything, even when there's no threat. Instead, pain signals get amplified. Your spinal cord, especially a region called the dorsal horn, starts to behave like a broken thermostat. It can't tell real pain from noise anymore. So even a soft bedsheet brushing your toes might feel like burning. Now here's the hard part. Even if your glucose is stable, even if you're eating well and taking meds, if your sleep is broken, your nerves stay on high alert 24/7, like a car alarm that keeps going off because no one resets the system. Tonight, instead of scrolling, try sitting in silence for 10 minutes before bed. No screens, just breath. Give your nervous system the space it's been begging for. Cut caffeine by mid-afternoon, even decaf. Yes, it matters. Build a predictable bedtime rhythm. Same time, low lights, soft sound, no stress. It's not fancy, but it's medicine. And if you wear compression socks for circulation, take them off before sleep. They can quietly restrict blood return while you rest. Your nerves can't begin to calm until your brain gets a full, undisturbed night to reset its alarm system. If this is the first time someone has explained your nerve pain like this, consider subscribing. This channel's here to say what most won't. And the worst part? You probably won't blame your sleep. You'll blame your meds, your feet, your age. But not the fact that your brain didn't get enough time to turn the pain down overnight. Linda started wearing earplugs, cutting caffeine after noon. More importantly, she stopped telling herself, it's just part of getting older. Because it's not. But even with better sleep, what if your most trusted tool, the one thing you thought was protecting your feet, is the very thing making them weaker, day by day? You've been told it helps. But I'll show you why it might hurt. Next. Number 3. Footwear that kills feeling. If you live with diabetic nerve pain, chances are you've tried those soft, supportive shoes, the kind labeled orthopedic or diabetic approved. Thick soles, memory foam, tons of padding. They feel safe, gentle, comforting. But what if that comfort is quietly numbing your brain's connection to your feet? You see, your feet aren't just for walking. They're sensory organs. They send constant signals to your brain. Pressure, position, temperature, texture. That system is called proprioception, your body's internal GPS. And like any system, if it stops getting feedback, it starts to fail. Let me tell you about Mrs. Carter. She's a retired math teacher, diabetic for over 20 years. After some numbness in her toes, she did what everyone told her to do. She bought the softest, most cushioned diabetic shoes she could find. At first it felt great, but within months, her balance got worse. Her gait changed. She stopped feeling where her foot landed. And the pain, it didn't go away. It spread, became dull, then sharp, harder to explain, harder to treat. Here's why. When your brain stops getting clear, regular signals from your feet, it begins to lose the map of your lower body. Like a radio picking up static, it knows something's there, but not clearly. That sensory blur can trigger misfires, pain where there shouldn't be pain, weakness where there should be strength. And over time, the less feedback your nerves get, the faster they degenerate. No stimulation equals no maintenance. Now, this doesn't mean you should walk barefoot across gravel, but it does mean your shoes need to give your brain just enough feedback to stay in touch with your feet. Thin soles, flexible bottoms, ground feel. Because safety isn't just about padding, it's about connection. Take a look at your shoes, not how they feel, but how they function. If you can't bend them, if they're too stiff to twist, your nerves might be cut off from the ground. Try walking barefoot, not outside but indoors, on a safe surface like a soft rug or yoga mat. Let your feet speak to your brain again. You can also gently activate foot nerves by doing toe spreads, ankle rolls, or simple heel raises while brushing your teeth. It's not about going minimalist overnight. It's about waking up a part of your body that's been cushioned into silence. If you know someone who swears by their soft diabetic shoes, send them this part. It might save their balance and their nerves. So if your shoes, designed to help, might be making your nerves worse, what about your supplements? Some supplements may support healing, but others, they could actually delay your recovery, or worse, give you a false sense of progress. Let's talk about the difference next. Number 4, supplement overconfidence. Let's be real for a second. You've tried the supplements: alpha-lipoic acid, B12, benfotiamine, maybe even turmeric or CoQ10, because someone on YouTube said they'd heal your nerves. But now it's been 6 months, a year, maybe more. You've spent hundreds of dollars, and your feet? Still numb, still burning, still not yours. Here's what most people don't get and most marketers won't tell you. Supplements can help, but they're not magic pills. They work only if your body can use them. Take B12, for example. Sounds harmless, right? But if you're taking the wrong form, like cyanocobalamin instead of methylcobalamin, your body might struggle to convert it, especially if you have a methylation defect, and over 40% of people do. And even if you're taking the right form, if your folate is low, or your digestion is compromised, or your glucose is constantly spiking and crashing, that nerve won't heal, no matter how many pills you swallow. Same with alpha-lipoic acid. Yes, it's been shown to help some people, especially in Europe where they use IV versions in clinical trials. But your daily 600 milligrams capsule, if you're also inflamed, sedentary, or missing key antioxidants like glutathione, it's like trying to put out a house fire with a water bottle. So this isn't about blaming supplements, it's about respecting their limits. Because when it comes to nerve pain, stacking pills without strategy is like assembling furniture with the wrong tools. Frustrating, expensive, and sometimes dangerous. And here's the kicker. Too many people feel guilty when the supplements don't work, like it's their fault. It's not. You were sold the idea that these were the fix. But healing is more than a capsule. Flip the bottle. Look closely. Does it say methylcobalamin? If not, it may be time for a different form of B12, one your body can actually use. And while you're at it, consider the bigger picture. B vitamins don't work in isolation. They need folate. They need support. They need your gut to be calm enough to absorb them. If you're taking alpha-lipoic acid, ask whether pairing it with acetyl L-carnitine or CoQ10 would make it more effective. And ask your doctor, not the internet. Supplements can support healing, but only if you're not skipping the conditions that make healing possible. What's the supplement that gave you the most hope and the biggest letdown? Let's talk about what worked and what didn't in the comments. It's about timing, inflammation, blood flow, sleep, glucose, nutrient synergy. And yes, sometimes medication or therapy too. Because when it comes to nerve healing, it's not just what you take, it's how your body uses it. But let me ask you something. How tightly are you controlling your blood sugar? Because in the next few minutes, we'll explore one of the most counterintuitive truths in diabetic nerve pain. Sometimes, the harder you push for perfect glucose control, the more damage you might be causing. 5. When A1C is too low, let's talk about Steve. He's 68. He's done everything right. Low-carb meals, regular walks, no skip meds, and his A1C, 5.7%. His doctor said excellent control. But Steve doesn't feel excellent. His feet burn at night, his balance is worse, his hands go numb when he drinks coffee. And here's the thing, nobody warned him. You can control your blood sugar so tightly that it starts hurting you. Sounds backwards, right? But this is what the research and real-life experience shows. In people with long-standing diabetes, especially those with existing nerve damage, pushing A1C too low can actually reduce blood flow to already struggling nerves. Nerves don't just need sugar, they need oxygen, perfusion, time to recover. But when you drive your glucose down too aggressively, especially with strong meds or sudden lifestyle changes, you risk something called hypoglycemic ischemia. That's a fancy way of saying your nerves are starving in silence. And worse, when nerves are already damaged, their ability to sense hypoglycemia fades. That means your body can't even warn you when it's slipping too low. So while you're chasing that perfect number, your nerves are drowning quietly under the surface. This channel isn't about hacks or hype, it's about clarity. If you want more real conversations like this, hit subscribe and stay with us. Now don't get me wrong, glucose control is vital. But like most things in medicine, context is everything. If you've had diabetes for 15 years, if your nerves are already injured, if you're on multiple meds or over 65, then normal for you might look very different than what's printed on the chart. Instead of chasing a number, ask a better question. How does my body actually feel at this A1C? Do your feet burn more at 5.7 than they did at 6.4? Are you having silent lows, the kind that don't show up until the damage is already done? Ask your doctor if your glucose goals are still right for your age and condition. Request a foot sensitivity test, or even a perfusion study, to understand what your nerves are telling you. Because sometimes, protecting your nerves means loosening your grip on perfect and reaching for balanced instead. Sometimes, the bravest thing isn't pushing harder, it's stepping back. Asking, what does my body actually need now? Because healing your nerves isn't about chasing perfection. It's about knowing when the goalpost has moved and why. Your nerves reclaimed. You've been told nerve pain is inevitable, that it's part of aging, or part of diabetes, or just your new normal. But here's the truth. Nerve pain isn't just about what's broken. It's about what's been overlooked. For years, you may have blamed yourself for not doing enough, for not eating perfectly, for not fixing it. But maybe you were never the problem. Maybe the advice just wasn't complete. Now you know what most people don't. That shoes can weaken sensation, that sleep isn't rest, it's repair, that supplements are tools, not miracles, and that sometimes the pursuit of perfect numbers comes at a hidden cost. So here's your next step. Not to try harder, but to listen deeper. To your nerves, to your patterns, to your progress. Because healing isn't a finish line. It's a conversation, one your body has been trying to have with you for years. If this video gave you a new perspective, share it. Someone you love might still be chasing the wrong goal. And if you've lived this journey yourself, drop a comment below. Your story might be exactly what another person needs to keep going.